What's going on, guys? I'm Lakota from Meyer Mediums, and this is another chiropractor video. Now, in my last video, you guys got to meet my chiropractor, Dr. Michelle Corvallis, while she was reacting to YouTube chiropractors. There were other reasons that I went down there. One was to shoot a commercial for her. Two was I needed an adjustment, and she let us film that. Spine health, I believe in it. I am usually sitting down, working on a table easel, or just working on a table, bent over like a banana. My posture is awful, and I'm not the only one. All you other artists out there, your posture probably sucks and your backs probably hurt. I know they do. I see it in my Facebook feed all the time. I asked Michelle if I could come down and film the adjustment, but also if she would explain how we as artists can take care of ourselves better, because it is important. This is how we make money, and we tend to make less art if we're in horrifying pain from a pinched nerve on our neck, which means less money. One other thing that I would like to say about this video before we get into it is that I had to tinker around with the lighting situation in post because the lighting situation there wasn't optimal. The lighting in the front room was great, but once you get back to where you actually get worked on, no windows, not that great of lighting. It's a nice light. It's darker, but it's also kind of welcoming. It makes you feel all warm and fuzzy on the inside, like walking into a pleasure dungeon. Well, that doesn't sound quite right. You know what? Getting your back popped feels good, so I'm going to stand by that statement. So if the lighting seems a bit hinky, it's because it's a bit hinky, but you'll get past it.
So what's going on, Lakota?
Alright, this trap just started giving me trouble. The only thing that's really feels wrecked right now is my neck. And like it was so bad yesterday that it felt like it was pulling my jaw in the opposite direction.
Okay.
And I've had, how many days have I had a headache? Like, that's why I took a nap. It's just like 3 or 4 days of just constant headaches. So.
Okay. Well, go lay down on your stomach for me. Do you guys have a white dog?
Mm-hmm. Yes. So I was covered in dog hair. I didn't think it looked so bad.
So your low back's moving pretty good.
That's good to know.
Yeah. Right there.
So what is the purpose of the stretching the lower back?
So the purpose of especially this technique is to stretch all of the muscles and ligaments and tendons attached to the vertebral bodies. So a lot of low back problems are not vertebral, they're actually musculature, and that's what causes the vertebral problem to occur. So this is why this stretching is really good for the low back, because again, it releases all of those muscles. It also, this technique rehydrates the disc spaces via the pumping action. So, you know, when you are, first thing in the morning when you first wake up, your disc space is nice and hydrated, but as you go through the day, it dehydrates because all of that fluid just gets pushed out because of gravity. So this helps push that hydration back into the disc space, which protects the disc. Also, stretching these low back muscles helps keep your pelvis aligned better, because these big muscles also connect to your pelvis. So if they get really tight, they'll pull your pelvis out.
It feels pulled out.
It feels
I was sitting here thinking, I was like, man, I'm doing good. And no, it doesn't hurt, but
it'll make you honest.
Yeah, that's a good way of putting it.
Or like when people are like, oh yeah, I've been stretching, I swear. Then they lay down on the table.
You ain't stretching like this.
You're out on the right. Bend your knees. All right, so, of course, bottom piece is gonna pop up. All right, deep breath in for me. And again, deep breath. And out. Okay. Last one. And out. So the purpose of the drops, this part is because it just makes my job easier. It's a little more physics when you use the drops.
Makes sense.
Big deep breath. And out. And out.
Oh yeah.
Deep breath in. And out.
Man, I was expecting that to be a lot noisier. It felt like it was gonna be.
No, when you're really out, you don't make a lot of noise. That seems to be your thing. Now, every once in a while you do, but when they're really, really bad, you don't make much noise. I think that's because you just get so much inflammation.
Are you noticing a change in my back ever since I started doing the working out?
Yes, so you're getting much stronger through your lower trap and into your lat, which is helping keep all of this where it was supposed to. When you stopped doing those rows, you got really weak through here, and that's when those ribs started to really come out. One more deep breath in. And all right, flip on over. Let's check that neck since it's giving you the problems.
Right here.
Right there. Okay.
Yes.
Right there. Yep. Right there. All right, last one.
Whoa.
Okay, go ahead and sit on up for me.
Headache instantly gone.
Mm-hmm.
Kinda. It's not as bad. Awesome.
C1 was out.
Was it?
Mm-hmm. It wasn't occiput this time. It was C1.
Oh, cool. I thought I was like, this has got to be my occiput with it being so high.
No, that was C1, but that would have turned into an occiput.
Yeah. This video is mostly for, it's supposed to be informational for artists because there's multiple people, lots of them, in my Facebook feed all the time complaining about back, neck, and just like, what are some of the things that they could be doing? So the majority of the time, this is our life.
Yeah.
So that's just the way it is.
Yeah.
Now I know that posture is everything, but it doesn't happen. So what can we do whenever we're, just to combat the back and neck pain?
To combat like the postural issue.
Yes.
So breaks is something I talk about with you all the time. Like you've got to take breaks. You know, if you're sitting there for an hour, try to get up for at least 5 minutes and like move, hit the reset button biomechanically and neurologically, because you've just got to move. We're not made to sit that long.
Yeah.
Too, and like the rows, those are really good because again, you guys, if you're an artist, you're always in this curled forward position, or anyone who works at an office job is always like this. So you've got to do the opposite. You've got to make sure that you do a lot of chest opening exercises, stretches, and like the rows that you do. That's really good because that's going to strengthen back here, so that way you can hold yourself up.
And it opens the chest.
And it opens the chest up, yeah, because you know this is where you're going to get in trouble, because eventually if you do this long enough, you're going to turn into one of those old people. You're just going to sit like this. So, and then like if you are an artist and you haven't been seeking a chiropractor, it's a good idea to do that, because that way they can get the joints moving as well, not just the muscles.
Gotcha.
You know, so it's something you got to be really aware of when you're stuck in a bad posture all the time.
We sit like bananas for 8 hours at a time.
Yeah.
For sure.
Yeah, and that's and especially like for people, everyone's left or right hand dominant. So whether, you know, I remember when we started working together and you were having forearm problems.
Yes.
And you were having it on both sides because you were not only using one side, you were also holding with the other.
Yes.
So it got a lot of forearm stretch is a big deal.
And that's another thing too, is one of the big things that helped me was get an easel, a table easel or a standing easel. It's so much better than working bent over a table, trying to get those fine details. It's much better bringing it up to you instead of bringing yourself down to it.
Yeah, that's a good idea. And that way you don't have to hold also. The easel will do it for you.
That's true.
But you know, like any stretching program is really important. For anyone doing anything, you've got to, again, just combat that day-to-day life, which by stretching, and that's the best way to do it. So.
Cool.
Okay?
Awesome. Thank you. All right, guys. Well, that's going to do it for this video. I hope that you enjoyed it and that you learned how to take better care of your back in the future. And if you're in the Farmington, Missouri area suffering from moderate to severe back pain, Dr. Corvallis knows what she's doing, and I would highly recommend her because she's probably the best chiropractor in this area. Everybody else pretty much just throws you over a barrel and kicks you out the door. Stay healthy, folks, and I'll see you in the next video. Ta-ta!